And I've been impressed at all the effort and kind of organization they put into starting to plan medical care for Olympic Games, and I'm convinced that it's going to be a really world-class care for all the athletes, and it's such a big project. And what I thought I'd go through here today is some thoughts on kind of organizing medical care for the Olympic Games. I've worked with our last 3 Olympic teams, Athens in 2004. It's supposed to be a video, but my video doesn't usually work. So the last 3 games, I'll kind of draw on my experience as a team physician with USA, talk about some of the resources that are required, and then my colleague John Kavanaugh, we worked together for a long time, will talk from his standpoint, from the physical therapist, and again on the resources required for organizing medical care. So my goal is to review what is required, the members of the team, the specific resources, what facilities are important, what are the supplies that we need to have, both in the hospital as well as on the field, what equipment is needed, and we should consider the various venues where these resources are required, both in the Olympic Village, at the Polyclinic, at hospitals all around, and not just right in Rio, but other sites where training will take place or test events will take place, and then certainly on the field. One thing I always say, if you prepare for problems, you won't have them. I think a lot of this in sports medicine, as you've heard in the preceding talks, is preparing for this. I think planning starts, years prior to the games, as you've done now. Establishing, when I think about traveling with our Olympic team, we set up years in advance, identifying local hospitals, local medical contacts to help us out. Think about just some general thoughts here, whether we need appropriate vaccines. If you're bringing your team here and you're coming from a different part of the world, are there specific vaccines that we should recommend to athletes? What do you need in your medical supplies, your bag? Other things to consider as a team physician. Is there air pollution where you're going to be? I remember before the Beijing Games, that was one of the concerns. We thought about, obviously, jet lag. Those are always issues that for physicians to think about. As you get closer to Olympic Games, I think as a physician you need to consider your athletes and your staff, their medical histories. Know your patients, know your athletes. Who are you going to be taking care of? That will determine what resources you need. You may speak to the athletes' physicians at home. If you have athletes with specific medical problems, find out about those issues. Learn your athletes, learn your patients. In particular, identify athletes that have specific medical needs, diabetics, cardiac problems, things like this, seizure disorders, whatever it is you need to know. Consider the possible need for therapeutic use exemptions for restricted medications. Pulmonary function tests may need to be done if you have athletes on medicines for asthma, things like this. I think as far as the hospital-based resources, I asked to talk a little bit about that. For providing medical care at this level, you clearly need a multidisciplinary team. I think you're going to see, and I'm sure it's come out in the prior talks, the importance of a team approach here. On the surgical side, we need orthopedics, we need spine surgery, neurosurgery, certainly trauma surgery is important, and a host of non-surgical specialties listed here. Physical medicine, rheumatology, neurology, metabolic bone issues, pulmonary, cardiology, etc. All of these specialties you see listed here need to be considered and need to be available to the athletes both during training camps before the games as well as certainly during the games. It's a picture from Beijing, one of the hospitals there showing the different areas that are available and all the challenges you have as far as traveling to a new culture and a new environment. What was that? Radiology is critical. Obviously, X-ray, CT scan, ultrasound is becoming increasingly important both as a diagnostic modality as well as a treatment modality for ultrasound-guided injections. MRI, of course, used so much in soft tissue imaging in sports medicine. It's going to be critical to have the ability to provide rapid image interpretations. You need specialized radiologists around. Maybe telemedicine is something to consider as well. I think other critical areas that are of primary importance in planning, we need physical therapy, massage therapy is part of this, chiropractic may be included, and other fields such as sports psychology, nutrition analysis and counseling, motion analysis, performance testing, all of these different areas should be considered and available at some level to your athletes, both during training as well as during the games. Concussion evaluation, you've heard about that, clearly a critical and an area of emerging importance. We need to have the ability to evaluate concussion. Standard facilities we need in all of our venues, obviously a place to quiet examination rooms. I think this is important. You don't want to as a physician, you shouldn't examine the athlete in front of lots of athletes. Sometimes there are privacy issues. You need a quiet room the athlete can go in, and you can, so this is your private patient, just like in your private office in your regular day-to-day clinic. You need a quiet room to talk to the athlete, respect their privacy, all those type of things. But then certainly we'll have all of the comprehensive physical therapy center, and John will go over this more. All the standard modalities and resources you need are listed here. Clearly, this is the rehabilitation is a critical part of the medical team. Other facilities that need to be available to the athlete. You need an on-call physician, of course, 24 hours a day, 7 days a week. You need the ability to dispense medicines 24 hours a day. You need a pharmacy. Laboratory is critical. And Olympics I've been to, we've had a number of athletes do blood work for different problems over the course of the game, so that needs to be available. Plan for mass casualties. Plan for all the terrible things that you hope never will happen. Again, if you prepare for problems, you won't have them. I think these things are less likely, of course, but need to be figured into the planning when you're considering all the resources you need. How might you evacuate a big number of people, athletes or other? In fact, I remember when we went to Athens in 2004, that was the beginning, right after the 9/11 and the war was going on, and there was a lot of effort and discussion amongst our U.S. team about gas masks and things like that. We had a decontamination unit. We had these air contamination masks like you see in this picture. These are all things you had to consider in that time, and you have to, as a physician, provide some leadership there, teach your staff without making too much of it. Other facilities available to the athletes, the polyclinic in the Olympic Village is a critical place where most athletes and staff receive medical care. That's available to all credentialed persons in the village. Again, physicians are available 24 hours a day. That has all of the different specialties in addition to resources, X-ray, MRI, CT scan, laboratory, pharmacy, all these things that we've mentioned before, rehabilitation, all these resources need to be available in the polyclinic. It's a picture from Athens. It's the polyclinic there. Think about the specific medical conditions that you may have to take care of, and that'll help you identify the resources, both people resources as well as equipment resources. Specific things I think about in our athletes, which athletes have sickle cell trait or sickle disease you need to know about, especially in hot, humid conditions. Know your diabetic athletes. Know those athletes that have asthma and that have a problem with that. Know your athletes that have a concussion history. Know your athletes with a seizure history. And these are important things for the team physician and trainers to know when they're to provide optimum care to your athletes. And you'll treat a number of different conditions as a physician. And a lot of this is what I call travel medicine, things that, medical conditions that occur in the traveling athlete, from gastrointestinal problems to ear, nose, and throat, upper respiratory type of symptoms that are so common in the traveling athlete. Sinusitis, ear, things like this are so common. Urinary tract infections. Common thing we deal with the traveling athlete is sleep disorders. Anticipate that, know what you're going to do, when and which medicines you want to use if you choose to use medications for sleep. Obviously, trauma, lacerations, musculoskeletal problems are going to be important. So a number of things we need to prepare for, both medical as well as trauma and musculoskeletal. The medical team on the sideline, I'll mention briefly, and John Kavanaugh will go into this much more, but I think it's a team approach again. As far as physicians, we ideally have an orthopedist who is skilled in musculoskeletal assessment as well as primary care specialists. We need physical therapists, our athletic trainers, a massage therapist. These are all kind of the integral part of the medical team. A chiropractor may be available or involved based on the athletes and the team. Of critical importance is communication with the coach, the manager, the agent, the parent. I mean, this is a big role. Part of your job as a physician is organizing all of these different parts and keeping the lines of communication open. So you're talking to the athlete, of course, first, but also their agent, their manager, whoever it is, that's part of your job. Various medications that should be standard on the sideline or at a venue in any medical bag. For kind of emergency type of medications, asthma inhalers for asthma attacks, Valium for athletes that may have a seizure, concussions. I've seen seizures happen with concussion, or if you have an athlete with an epileptic history, you should know that and have these medicines available. EpiPen, of course, for allergic reactions. Glucose replacement, 5% dextrose for our diabetics, things like that, IV fluids. Many of these things, of course, are all restricted and can only be used in an emergency setting with a therapeutic use exemption only given after these are used for emergency use. So I'll mention in a moment doping control issues, but as far as be able to take care of the emergencies that may happen on the field of play, insulin, things like that. Other equipment that's needed on the sideline, in addition to medicines, obviously spine board, your automated external defibrillator should be available. Know where that is, know that the batteries work, know how to turn it on. Be ready if you need to do any intubation or have an oral airway. You may need to have airway specialists on hand, know where your ambulance crew is. Other less common things we have in our medical bag, things for evaluating corneal abrasions and things like that. Certainly splints, tape, casting materials are all very, very commonly used and will be part of your medical bag, and I'm sure John will show more of that as well. This is just one picture of our contents of our medical bag. We have a big spreadsheet. This is probably one page out of 5, just all the different medicines. A lot of this is important to keep records. Which medicines you have, when they expire, who you dispense medicines to. Record keeping is critical. Obviously, there are doping control issues with controlled substances that the team physician is responsible for. Other things, standard medical equipment, stethoscopes, otoscopes, ophthalmoscopes, all the basic medical equipment that you need to consider as a physician and trainer to have available at your disposal on the field of play as well as in your hospital. Standard stuff for taking care of your teams. At the venues, again, a physician and trainer should be at each event. We have all these supplies and medicines that we've seen here. The local medical care at the venues is usually provided by the local organizing committee, so Dr. Grangero has a big job, and I know he's been working hard on starting to organize all of the medical care at all of these different venues. But think about sports-specific equipment. So if you're going to be at a diving venue, you definitely want to have a spine board, maybe a cervical collar. If you're covering boxing, you better sure have sutures. You want to have sutures anywhere, but especially at boxing or a martial arts event. So think about things like that. Know where the ambulance is. Know the route to the local hospital. Again, as a physician, when these emergencies occur, you want to have done your homework in advance and be prepared. Again, review your evacuation plans. All these things need to be figured in planning medical care. Be prepared for very diverse environments. So the hospital setting's easy. It's a controlled environment. You've got your resources. But as a physician or trainer, you may be asked to go cover events all over the place, different venues, different areas. There's some pictures. You may be out here at the track. You may be indoors at the gymnastics facility. You may be at a pool. You may be outdoors somewhere on the marathon, and you may be way out somewhere on the marathon covering the event. Open water has its own challenges. Athlete goes under. What do you do? Who's available? All these things need to be prepared and thought about in advance. This is pictures of it's an AED I came across in Beijing, and these are the instructions on the right there, so I made sure I figured out how to turn this thing on. Just to give you an example, with our U.S. team, this is our medical staff here. We have a director of sports medicine, and then we'll have a chief medical officer for our U.S. Contingency, and then usually 9 or 10 physicians in all the major sports. And then physicians, we also cross-cover each other. So you may be the physician assigned to soccer, but when you're not with soccer or football, you'd be covering a different event. We have approximately 30 athletic trainers and physical therapists, massage therapists, several chiropractors. We have our own pharmacist, and often an exercise physiologist who's available for things like asthma testing. So it's again, a comprehensive team that needs to be assembled to provide optimum care for your athletes. This is just a small part of our group. John and I are there. It was in Beijing, I think. It's a team. Again, you've got your coach, you've got your athlete, you have your massage therapist, your trainer, your physician. It's all teamwork. That's the critical part. I can't emphasize that enough. And it's communication amongst the teams. You really provide the best care for the athlete. You're there for the athlete. We always say you check your ego at the door. You are there to take care of your athlete. If the athlete's successful, you're successful. Lastly, know your role in doping control, another important area for the physician. As a physician, you will often supervise this process for your athletes, assure that there are no deviations from the standard routines, so there's no tampering with the urine or even blood samples. You should help the athlete to list the medications that they're taking, which they have to do on their doping form. have the therapeutic use exemption forms available as needed if the athletes are on any medicines that require a therapeutic use exemption. Be prepared for testing at all times. They can come knock on your door any time of day or night, any time before the games as well. So we've had drug tests at training camps in different countries well before the Olympic Games start. Use the doping control forms that need to be filled out, and as a physician you can help make sure these are filled out accurately, and that the athlete lists all their medications that they are currently taking. Know the doping control officers. These guys can they can help you if you're nice to them, or vice versa, so be nice to them. You spend a lot of time in doping control sometimes as a physician or trainer accompanying your athletes. Know the prohibited list. This is critical to know the up-to-date list for what is prohibited, and both in competition as well as out of competition. That's your job as a physician. I put this slide here. This particular one shows substances that are prohibited in particular sports. So different sports have their own lists. For example, beta blockers can't be used in things like archery or darts. There's no darts in Olympics, but you can't calm your nerves. So know your specific sport, know the drug list for your sport. If the athlete's using a restricted substance, they may need a therapeutic use exemption. Prior approval must be obtained by the athlete to use substances or methods whose use is otherwise prohibited. There's a committee that reviews these. Again, as a physician, your job is to understand this process. Again, if you prepare for problems, you won't have them. I think that is the message that I would leave you with here. Thank you. Obrigado.